Okay, let's be real for a second. There are very few phrases that can make your entire body tense up, quite like hearing your dentist say, you might need a root canal, right? It's just a moment that's instantly filled with a ton of questions and, yeah, a little bit of stress. But what if we could flip that script? What if we could turn all that uncertainty into real clarity? Well, that's exactly what we're going to do. We are going to break down the entire decision-making process so you feel like you're in the driver's seat, not just along for the ride. Hearing these words from your dentist, it's more than just being told you need a procedure. It's like you've arrived at a crossroads for your dental health, and the choice you make has some serious long-term consequences. So the real question isn't just how the root canal gets done, but the much bigger question of if it should be done at all. And this, right here, is the fundamental choice it all boils down to. On one side, you've got the root canal, the all-out effort to save your natural tooth. And on the other side, extraction, just taking the tooth out completely. Now, both of these are totally valid medical options, but believe me, they lead you down two very, very different paths. Okay, so before we can even start debating which path to take, we have to clear a critical first hurdle. Your dentist has to play gatekeeper and figure out if your tooth is even a candidate for being saved in the first place, because, not every tooth is. And this is honestly the first and most important checkpoint in the whole process. So when does your dentist give the green light? Well, it's usually in a few key situations. Maybe you've got a really deep cavity, or you took a hit to the mouth and now the nerve is involved. Or maybe the x-ray shows a clear infection brewing at the tip of the root. Sometimes it's actually a strategic move. You need to do a root canal to build a strong foundation for a crown later on. The common thread here is yes, there's a problem, but it's a problem with a good, predictable solution. But a root canal isn't a magic wand, and this slide shows the absolute deal breakers. If the tooth doesn't have enough bone and gum holding it in place, it's like building a house on sand. Or if there's a deep vertical crack running down the root, game over. It's just not salvageable. The same goes if there's so little tooth left that you can't possibly build a crown on it later. In these cases, even the most perfect root canal in the world is, unfortunately, a waste of time. So let's say the tooth does clear that first hurdle. It is a candidate for treatment. Well, now the real investigation begins. I want you to think of your dentist as a detective at this point. They're gathering clues, looking at all the evidence, and trying to build the best possible case for a successful outcome. And they focus on three key areas to get the whole story. This is the playbook for making a great decision. Notice where it starts? With you, the patient. Then we zoom in on the tooth itself, the scene of the crime, if you will. And finally, it involves a really honest, professional look in the mirror from the dentist about their own skills and the case's complexity. Let's dig into each of these. First up, you. I know it might seem like this is all about one little tooth, but your overall health plays a massive role in this. Your body is one big connected system, and what's happening in the rest of it can absolutely affect what happens in your mouth. For example, let's talk about diabetes. If it's not well controlled, it can slow down your body's amazing ability to heal. Now, that's crucial information for your dentist. Knowing that, they might decide to prescribe an antibiotic before the procedure, just as a precaution to give your body a little extra help to heal up perfectly. Or what about something like high blood pressure? This affects everything from which anesthetic is safest to use to what you can take for pain afterward. I mean, some common anti-inflammatories can actually mess with blood pressure meds. It's this delicate dance, and your dentist needs to know all the steps. And this quote, this one is so important. Your mental state is a physical factor. Being super anxious isn't just a feeling. It can literally make it harder for the anesthetic to work, and it can even lead to more pain after you go home. A great dentist knows this. They'll take it seriously and might use what's called a stress reduction protocol to make the whole thing way better and way more effective for you. Okay, checkpoint number 2. Now the investigation zooms in on our main suspect, the tooth itself. What is the actual problem we are trying to solve here? Because the strategy is going to change completely depending on the answer. Generally speaking, there are two main scenarios. In what's called a vital case, the nerve is still alive, but it's screaming in pain. It's super inflamed. The challenge there is to manage that pain and gently calm things down. But in a non-vital case, the nerve is already dead, and the real enemy is bacteria that have moved in. The goal there is totally different. It's an all-out mission to disinfect and get those bugs out of there. And right alongside that diagnosis, there's a huge, practical question that has to be answered before anyone even picks up a tool. You see, a root canal can be a technical masterpiece, But if you don't have enough healthy tooth left to build a solid, working crown on top of it afterward, the whole thing is for nothing. You have to know you can finish the job before you even start. This brings us to our final and maybe most crucial checkpoint, the dentist themselves. A truly responsible dentist takes a hard look at the case, at the x-rays, at you, and they ask themselves, do I personally have the exact right skills, experience, and gear to give this specific patient the absolute best result? And if the honest answer to that question is, maybe not, that's when you get a referral. And please hear me on this. A referral is not a failure. It's a sign of excellent top-tier patient-first care. It means your dentist ego is not in the way, and they are committed to getting you to the absolute best person for your specific job. So why would they refer? Well, sometimes the tooth is just incredibly complicated. We're talking roots with crazy hairpin turns or S-shapes, or tiny extra canals that are almost impossible to see without a microscope, or canals that have gotten all narrow and blocked up over time. These are the kinds of challenges where a specialist, an endodontist with their specialized tools, is just better equipped to navigate the maze. But hey, it's not always about the tooth's weird anatomy. Sometimes the referral is about you. If you have a really complex medical history, or you're one of those people who's just notoriously hard to get numb, or if the symptoms are just plain confusing and the diagnosis isn't obvious, a specialist has the extra reps and training to crack that case. Okay, so the decision is made, we're moving forward. Now we get to one of the most common patient questions of all. Hey doc, can you get this all done in one appointment? And the answer to that comes from crafting that final treatment blueprint based on all the evidence we've just gathered. And there's a real debate here. Look, a single visit is awesome. It's efficient, it's convenient, it's less time off work. But for teeth that are really infected or super inflamed, trying to be a hero and do it all in one sitting can be a mistake. A second visit allows the dentist to put medication inside the tooth for a week or so, let everything calm down, and then finish the job. It can make a huge difference in preventing a painful flare-up later. This table basically lays out the checklist your dentist is running through in their head. You see on the left, straightforward cases on living teeth. Those are often perfect for one visit. But look at the list on the right. A dead tooth that's really painful, a big infection, a crazy curved root. Those situations almost always scream for 2 visits. It's just the safer, more predictable way to go. So when you boil it all down, the journey from that stressful moment of hearing you might need a root canal to a successful, comfortable outcome, it's a partnership. It's not something that's just done to you. The absolute best treatment plan is always built on a foundation of a really thorough evaluation and just plain good open communication, where you are an active, informed member of your own team. And that's the whole point. Understanding this process, it empowers you. It changes the entire conversation from one of fear to one of curiosity and collaboration. So the next time you're in that dental chair, whether it's for a root canal or just a checkup, you'll be so much better equipped to understand the why behind the what. So I'll leave you with this to think about. What will you ask?